from Mombasa, where the government has in the last hour offered doctors what it calls a new deal to end the strike. The deal that the government says will cost the taxpayer some 4 billion shillings each year was presented at a day-long meeting between the doctors and President Uhuru Kenyatta. We can now take a look at that deal and how it compares with what the doctors initially wanted. So let's take a look at this here on my super wall. The doctors had made a number of demands that they have been clamoring for the last 31 days. It wasn't just about the money, it goes beyond that. First off was a review of the job group from M to L. And what the doctors wanted was that they would, let's take it a little slower and then we can move on. So they wanted to start hiring from the higher job group of M instead of L for the post of medical officer intern. And those who were in job group L would automatically be promoted. This is what the government has offered tonight. They have offered to raise the entry-level grade into the public service from M to L. So the government has essentially granted this demand, saying it is higher than the normal entry for other public servants and therefore recognizes the doctors' professional training. Now, on the next issue that the doctors had been clamoring for is their postgraduate studies. They wanted training to be catered for by the Ministry of Health, and they wanted 400 to be trained in various different specialties. There has been no mention of this from the government tonight. On the other issue of promotions, it had been said by the doctors that some had remained in the same job group for close to 5 to 10 years, and they wanted promotions effected. Again, we haven't heard much from the government on this deal tonight, on this particular issue. But here's the big one, the sticky one that is going to cost quite a bit of money. They wanted an increase in the basic pay and allowances up to 300%, according to a CBA that had been signed way back in the year 2013. That wanted, it would have cost you, the taxpayer, about 2 billion shillings without the arrears, but round about 8 billion shillings if you consider the arrears going back to 2013. The issue of that arrears is a bit sticky because the CBA comes into effect once it is registered at the court. And this was one of the points of contention with the doctors. It has been signed, but yet to be registered in a court of law. What has the government offered with this tonight? Well, the president's deal is as follows. It's the enhanced emergency call allowance. They have increased from 66,000 from 30,000 for those in job group L. That is a 100% increase. There has also been an increase in that enhanced emergency call allowance for job groups M to P. That's 30,000 to 72,000. And from job groups Q and above, from 30,000 to 80,000. In addition, there's also a new doctor's risk allowance that has been given. All of this that the government has given to the doctors today will cost you, the taxpayer, 4 billion shillings to be spread out amongst the 5,000 doctors. The basic pay increases by about 56,000 more shillings. And this is the deal that has been offered by the government tonight. Will the doctors agree to these offers that have been put on the table? Let's take a look at the final demand that was made by the doctors over the last month or so. They wanted more medical practitioners hired. How many? They wanted 1,200 doctors hired per year. And this is across the different fields. That's dental practitioners, pharmacists, and doctors. So this is the deal. This is the demands. And we've also told you about the deal that has been made by the government that would cost you 4 billion shillings if the doctors agree to the offer that has been placed on the table. Some say this is pretty much the same offer that had been made twice before. So let's